name is Whitney May, and I'm a patient here at Westdale Dental Center and Dr. Kwong Hing in particular. And I'm here today to talk about how good I find everything, not only the services, but the dental treatment and what's been done, and the fact that they're still there, and that where I had holes and maybe would have had bridge and eventual bone loss because of implants, I have a jawbone that's not receding and teeth that I can use, which is incredible. I am in my 30s and started in my early 30s with Dr. Al, and it had multiple root canals, and abscesses kept happening. They were falling out of my head. For various reasons. For me, it's hereditary. Both parents' sides have really bad teeth, and are going through their own thing. And actually, two of them, my aunt and uncle, did implants and got rid of plates, and were so excited by it because of hearing about my experience, and just really with the implants being there to stop the bone loss when I'm a young woman, relatively speaking, and so being a young woman, that's very big to me when someone says to me, we need to pull all these teeth. It's traumatic. It has to do with appearance, with eating, with your stomach health, with your mental health, with your everything, and so to be taken into a fold where not only did they tell me that, but they made me feel okay. And then, although as I said, I'm in the process, so the top, I have my implants in, but I do need the bridge put in, so that's upcoming. But I know what to expect because I do have one bridge on each side of the bottom already. So I'm left with these as real. And eventually when they unfortunately go, then I'm going to be connecting them together. And it's so different than saying to someone my age, you need full dentures. That is an insane proposition. My friends are dealing with a lot of other things, and it's, that's not one of them. And it's not, oh, poor me, but it's what the situation is, and it does need to be dealt with. And it is emotional, and it is traumatic. And yet at the same time, I would have said, for the most part, it was just emotional. There was no traumatic part to it because I was taken such good care of. And then everything that they told me was going to happen. Everything was laid out before the surgery. This is what we're going to do. This is how we're going to do it. This is how long it'll take. Spoke to my boyfriend as well, my partner. And another time I think my mom came, so they talked to her. But I had been to the treatment center in Toronto as well as here, and just the support staff and everyone else telling you what to expect. And then when you come out of it, and it's pretty much exactly what they said. And I mean, as for swelling and some of the other side effects, of course, it's different for everyone. So those things aren't an exact science. But the mouth is a good healer, even if my teeth are awful. And the strength that I have now, I can actually masticate my food and chew my food, which, as I said, I had digestive problems before, because I was missing a tooth, and then I had root canals, and then I'm trying to pay for all these root canals, and they're still falling out. So why am I spending all this money on the root canals? And just the way that I was taken in also financially, and looking at what my insurance does cover, what it doesn't, and what I can pay for when I can. The main theme here is that they're just here to take care of me, and we'll talk about the rest, and we'll get the rest. And it can be daunting, that part of it as well, the financial. It's a lot of money, but I also spoke to how many root canals I had, and I had already spent thousands of dollars on things that weren't working. So when asked to invest money in myself and in my future in something that's going to work, it was a no-brainer. And I worked through the finances and paid off, and the staff celebrated with me the day I came in to make my last payment, because they knew me from coming in and making payments. How special and great is that, to have that there as well?